information on prevention, tools for a healthy lifestyle. Make little changes to be the best you. It's all here. A podcast empowering, informing, and motivating Bermuda to live well. Bermuda Health-Abets. Everything from A to Z on healthy living. Brought to you by the Health Promotion and Wellness Office of the Department of Health in collaboration with local health partners.
Welcome to another episode of Bermuda Health-Abets, a podcast where we discuss everything from A to Z on healthy living with a mission of empowering, informing, and motivating Bermuda residents to live well. I'm your host, Yosifia Spence from the Health Promotion and Wellness Office at the Department of Health. And I want to welcome our listeners today. Thank you for tuning in, our Bermuda Health-Abetters. And our topic today is falls prevention. And our guests are Nicole Blades and Shirle Crockwell from the OTPT department. Nicole, can you introduce yourself? Tell us a bit more about you and your role.
Sure. So thank you for having us today to speak on this subject matter. So my name is Nicole Blades. I am an occupational therapist. I've been an occupational therapist since 1996. I actually trained in the UK, and I worked both in the UK as well as in Bermuda at Bermuda Hospital Board, and then I came over to the community rehab services of the Department of Health in 2015. And I am an occupational therapist within the seniors team, so that's working with people 65 years and up. So
Okay.
That's me.
Okay, and so Cheryl, can you tell us a bit more about yourself and your role?
Yes, I also work for the Department of Health, the Community Rehabilitation Department, right presently with the seniors team. I've been a physiotherapist since 1984.
Okay.
I worked for King Edward Hospital for 11 years,
Oh, wow.
and then the Department of Education for 3 years, and I've been at the Department of Health since 2000.
Oh, wow. Okay.
And in that time, I've worked with the school age population, the early intervention group, that's a birth to 4 years old,
Okay.
and the seniors, and I've switched during that time, but right now I've just come back to the seniors.
Okay, thank you so much for introducing yourself. So, welcome, and thank you for agreeing to come on and speak to us on this very important topic,
Thank
I
you.
feel.
Thank
So, our topic again, audience, is falls prevention. So, what I'd like to know is, what is falls? You know, because we're talking about falls prevention. So, how would you classify that?
Yes, so what we'll do is we'll start with the definition again from World Health Organization. So basically, they define a fall as an event which results in a person coming to rest on the ground or floor or other lower level. And fall-related injuries may be fatal or non-fatal, though most are non-fatal. So we just want to focus on the latter part of that definition during this podcast.
And that will be the non-fatal,
Non-fatal, yes.
component.
Yes, because we can do a lot of things to prevent them, which is what we're going to speak on today.
Okay. Did you have anything else to add to that, Cheryl? In reference to what is a fall, or how would you define
there
a fall?
are two main types of falls. Nicole, want to tell us about those?
Sure. So the first one is an accidental fall, and that's a fall that occurs due to environmental risk factors or hazards. So, for example, water spilling on the floor, clutter, cords going across a floor, or making errors in judgment or not paying attention, which, you know, we all know about. The next main type of fall is an anticipated physiological fall, and these are factors associated with known falls risks that are predictive of a fall occurring. So, for example, loss of balance, impaired mobility, impaired cognition, confusion, impaired vision.
Okay.
And falls that we anticipate will occur due to the patient's existing physiological status, history of falls, and decreased mobility upon assessment.
Okay.
So there are several different types of definition, but these are the two main types.
Okay. So, First of all, I didn't even know that there was like a classification of falls.
Of course, yes.
But
yes.
that's why we're here today.
Yes.
And so when we talk about falls, and you're saying there can be accidental or there could be anticipated based on a person's condition or environment.
Mm-hmm.
So what do we do in reference to this? Like, what is falls prevention, right? Because that's what we're here to talk about today. Or did you want to add anything
Yes.
else?
Mm-hmm. So we wanted to, because as you said, a lot of people don't really know about this subject matter, or they have their own perceived thoughts on it. So we just wanted to start off with something fun, talking about debunking falls myths. So
Okay.
we'll see how many people get right. So this is just a true or false.
Okay.
But of course, we will focus on a lot of the responses throughout the podcast. So the first one is, only frail or infirm people fall. True or false?
False.
Very good. Next one, falling is not inevitable. True or false?
Falling is not inevitable. Oh, that one's tricky. I would say false.
It's actually true. True, but we'll talk about it again.
Falling is not inevitable.
Yeah. So it's
Yeah.
true.
Why would you say that one is true? It's not inevitable in terms of.
Because we can prevent them.
Okay, got you. You got me with that one. You got me with
That was a
okay.
trick
That's a trick question. I'm so
Okay,
sorry.
next one. Go
Next
ahead. No,
one.
look, good because I
Right.
learned something there.
Yes.
Just right there.
So falls cannot be prevented.
That's false.
Great.
Very good.
If I limit my activity or stay at home, I won't fall. True or false?
False.
Good. I need to get my vision checked regularly. True or false?
True.
Good. Muscle strength can be regained. True or false?
I think that's true.
Yes, you're doing pretty well.
Very
Taking
good.
medication, if you're prescribed, doesn't increase my risk of falling.
That's a trick, but I guess it depends on the medication. So it could potentially increase. So I would say, what was?
So taking medication does not increase my risk of falling.
That's false.
Yep, that's another trick question, but yes, that's good. Using a walking aid will not make me more dependent. True or false?
Will not make you more dependent. Using a walking aid will not make you more dependent. That's a trick question too, as well, because I think it also depends on why a person is using the walking aid, and if you're recovering from something, you know. I would say false, but did I get that one right?
Well, it's actually true because we'll talk about it, but basically if you have the walking aid, it can help you to be independent based off of where you are.
Well, I guess I meant to say true, that it will not make you dependent
Right.
because
Yes.
Right.
at the end of the day, like, you
Yes.
could just be using it to get back
Right.
to a state of being strong
And
enough
it
to
helps you
actually.
be
Yeah.
Exactly.
Okay.
Exactly.
Go ahead. Next
yes.
one.
Two more. I need to talk to my family members or healthcare provider if I'm concerned about my risk of falling. I don't want to alarm them and I want to keep my independence. True or false?
True. You
Good.
still need
Yes,
to
you
talk
should.
to them.
Yes.
Yeah.
And that's a big thing. A lot of people don't. And the last one, I don't need to talk to my parent, spouse, or other older adult if I'm concerned about their risk of falling. It will hurt their feelings and it's none of my business. True
That's
or false?
false.
Very
Very
good.
good.
That's that was a good pop quiz.
Yeah.
Very good.
And
Okay.
all of that was adapted from the National Council on Aging 2017. So what we must know is that falls can be prevented and you have the power to reduce your risk.
Yeah. So that was good. You did quite well. So good.
I learned some new stuff today.
Yes.
But
So
yeah, go
going
ahead.
back to your second question, what is falls prevention? So with all of what we mentioned in mind, in general terms, falls prevention is recognizing, where possible, the falls risk and taking action to reduce the risk. And what we have to remember is that with regards to the senior population, falls prevention is a variety of actions to help reduce the number of accidental falls suffered by this population. So there's a lot of research going out there, I should say. Research indicates that falls prevention is successful when using a multifaceted approach in order to reduce the number of falls. And as a result, many jurisdictions, like in the UK, the US, and in the Caribbean, for example, have established falls prevention initiatives using the World Health Organization and the Center of Disease Control as their guide, in order to reduce the amount of falls incidences, especially among the aging population. So I know that's a lot being said, but yeah, so it is a big thing, big multi-million-dollar initiative that is going on.
So, I mean, because you mentioned two types of falls earlier, and you said there's predictable and there's accidental. And so do you feel that in accidental cases that falls can also be prevented?
Yes, they can.
Yes?
Yes, definitely. Yeah, so that's why falls prevention is important, because it would help to prevent some of those accidental falls.
And you said multifaceted approach. So when you mean multifaceted, because I know right now we have an occupational therapist sitting here and we have a physiotherapist sitting here. So when you say multifaceted, like what other components would be, a part of that multifaceted approach to preventing falls?
So, like, for example, other healthcare professionals, so we talked about vision, which we'll expand on later. So having input from an ophthalmologist or even an optician. You also have your GP, which should be at the center of it all. And then you have other sort of entities, like, say, for example, Corporation of Hamilton, for example. If there are issues with pavements, raised pavements and things, we need to get all entities involved to help to mitigate falls. So
Understood.
Not only in your home, but also outdoors as well. Everywhere you go, there's always a risk, right?
So what about, companies that, say, for instance, develop different things that go in the home, furniture or like bars that go on the wall.
And we're going to talk about that further on.
I'm getting ahead of the game, I guess.
Yes. You're getting ahead.
So we talked about what is falls prevention. So Shirle, can you tell me why is falls prevention important?
Okay, falls prevention is important so that you can assist with seniors being able to age in place within their own homes, and I know we're working a lot on that. People being able to stay home. Falls are a big cause of hospital admission and can result in serious injuries and or long-term complications. Thus, falls can decrease the cost on the healthcare system. I'm sorry, falls prevention can decrease the cost.
I got you. I understood the assignment, but for our listeners, falls prevention can
decrease the cost on the healthcare system. Individuals must also understand what puts them at risk so they can prevent falls, so they can take preventative measures. Falling can also contribute to a loss of confidence and independence. Thus, a previous fall puts you at the top of the risk, because there's a fall cycle. You fall, you're afraid to move, then you get weaker because you're not being active, and then when you do go to move, then you fall again, and then that starts the cycle again. And it's our job also to, when we go in there, because we often get referrals for people who have fallen, so we go in there, we assess them, look at the falls risk, assess their home, point out things that can contributed to the falls, and then we give them a home exercise program. Every person who we see, we give them a home exercise program.
That's interesting. And I know, because we're talking about, because earlier, Shirle, you mentioned the different populations that you've worked with, right? And I feel like we haven't pointed out that our focus really today is the aging population, or seniors, as some people would say. And so you talked about aging in place. And that's across the board in many, department and organizations who look at creating spaces where persons can age in place
Yes.
as long as possible, which you said, and I do agree, does relieve some of the burden on the healthcare system
Yes.
in reference to cost for the individual, for the system, right? And as well as it gives people confidence, like you said, to be able to be in their homes, to be able to be, aging in place as best possible with the
Right.
environments that they have.
Yes.
Okay. Anything to add to that, Nicole, in reference to why falls prevention is important?
No, I think we've touched on it, but it is a big subject matter, and sometimes people become quite sensitive when we do bring it up, right? But we just want to reassure them that that's why we're there, to help them to prevent falls prevention, help to prevent falls.
Okay.
Yeah.
So we just mentioned one of the populations that will be at risk, but in terms of falls, who would be at risk?
Actually, everyone is at risk of
Okay.
falls. However, many individuals of different ages and with various conditions, they may be more at risk of falling.
Okay.
And what we'll do now is we're going to go through a falls prevention risk plan. We'll identify some of the risks that that may be in your home or outside of your home, and we'll go through also what you can do about it.
Okay.
Okay?
So you said everybody is at risk for falling. That's funny because, my siblings for a while called me Clumsy Ella.
Oh dear.
I mean, no, seriously, I didn't like it. But there was this one time I tripped over this extension cord like 3 or 4 times. We were younger, we were kids,
Right.
obviously. I should have picked that extension cord up like after the first trip, right? But that just goes to speak to it really is not specifically your condition. It's just that you could be at more of a
Right.
risk based on
And
potential
that extension
conditions.
cord is a risk. That's one of the things that we will talk about too.
Okay, so let you go through your list of what can put you at risk for falls.
Yes, and there's
Okay.
quite a bit.
There's quite a bit, yes.
Okay.
Weak muscles or poor balance. So exercise, regular physical activity, and if necessary, referral to a physiotherapist. And if you're going to exercise, make sure that you engage in activities or exercises that are appropriate for your fitness level.
So that is what you do in reference to the risk of weak muscles. That's right. Okay.
Yes.
So you're saying what the risk is, and then what you can do for each risk
Yes.
as you go down
Yes,
the list.
yes.
Okay, go ahead.
And everybody can do exercises. It doesn't have to be going out to the gym and weightlifting.
Right.
You can do simple exercises, and that's what we mostly do in the homes. We give them simple exercises, something that's fit for them. And then if they can go on and do more, then we'll give them more.
Okay.
That there are some exercises, like some people will say, don't do any of the standing exercises when you're at home by yourself. So
And that would be specific to the
each
client, right? So
individual,
sometimes if you
Yes.
are doing a fitness routine, you need to consult like your professional if you're dealing with an
Yes,
OT or PT, or
exactly.
even if you're dealing with a a fitness trainer. It's that it needs to be tailored to the
to
individual.
individuals, yes.
Okay. Go ahead. Sorry.
If you have dizziness, lightheadedness, blackouts, fainting, or loss of consciousness, memory loss, confusion, or difficulties with thinking or problem solving, those times you need to consult your GP, your doctor, in order to ascertain the reason for these things. If you have vision problems, consult your optician for an assessment. And Nicole mentioned that earlier.
Yeah.
If you have hearing problems, consult an audiologist. And all of this goes back to going to your GP, because you may need referrals to
right.
different areas. Taking medication that makes you feel dizzy or drowsy. Again, consult your GP, and you have to be aware of how your medications affect you.
And I just want to add there, this is an important piece. Never stop taking your medication without the advice of your GP. So, if it does make you feel dizzy or drowsy, make contact with your GP first before you stop taking it, because it will cause
It can affect
issues.
something
Yes.
else.
Right.
So
Right.
just want to make sure that's said.
Yeah. And taking your medications as prescribed.
Right.
And sometimes you can have the little boxes that divide out your medication, but now many of the pharmacies are
Yeah, they
setting
do.
the
They send it like that because my
Yes.
nana gets hers like daytime, morning,
Yes.
night, that all separated. And
Yes,
that's
it's
pretty.
perfect.
That's pretty
Yes,
cool.
That's very
actually,
good
yeah.
and very helpful to
Okay.
people. Okay, if they have feet problems, including pain or deformities, because then you may be
Lose
walking and
balance,
like you may
huh?
not lift your foot up, and it can be something just very small, like a lip on the ground. If you're not lifting your foot up properly, your foot can get
I
caught
didn't
on
think
that.
about
Yes.
that one, which is interesting because your feet contribute to if you're gonna fall or not.
Right,
Right.
exactly.
Okay.
So a consultation with your podiatrist or chiropodist and having suitable footwear. And we'll go over footwear further on as well. If you have bladder or bowel conditions, again, your GP needs to be consulted for intervention or advice, because sometimes if you have a bowel or bladder problem, you may wait. So you don't want to rush to the bathroom, because then that makes you more at risk of falling.
Okay.
Yeah.
Okay.
Drinking any or too much alcohol, especially with medication, you have to be mindful
Okay.
of that. Drinking any or too much alcohol, especially with some medications, can make you unsteady, as well as it can slow your reaction time. You know, you may know you're going to fall, but your reaction time is,
Yeah.
too
you're
late.
not-
You
yeah,
can't
you didn't
prevent
put that
yourself.
hand out when you fell.
And so that makes you more susceptible to falls.
So we'll also speak on indoors and outdoors, and quite a number of falls happen in the home indoors. So the first one, which is a big one, lack of proper lighting or sensory guides. You should use at least a minimum of 60-watt bulbs. So we can light up and you can see where you're going. We won't tell you any stories about some of our clients, saying, "Oh, I gotta go to the bathroom," and their lights are all off. "Oh, I'll just feel my way," and then what happens?
Listen,
They're-
I am guilty of that.
Okay.
Like,
Well, we're talking to
getting
you.
up and I'm like, I know where everything is and waiting for my eyes to kick in for the tiny bit of
Exactly.
light that might be okay.
So that is very, very important.
And also there, I just spoke with my optometrist, and she reminded me that 60-year-old eyes need 2 to 4 times more light than 20-year-old eyes.
Really?
Yes.
So we have to keep that in mind.
My goodness. No, it's just like
Crazy, right? But yes,
Okay.
important. Another one is if you have difficulty opening and closing your windows or blinds, especially during this time, hurricane season.
Right.
But you do not. One of the things to mitigate is to have the objects in front of the window so that you can, easily access those items. Another big one is loose rugs or mats, carpets, throws. They are trip hazards.
I can see
So,
that.
Yes.
Yes.
So when we go into people's homes, we try our best to encourage them. Please remove them. But it is very difficult to convince someone to do that.
I can see
So
that.
what we will sometimes say, if you want them down, which is not what we would recommend, but if you want them down, to actually stick them down like with some double-sided sticky tape.
Okay.
Yes.
That makes sense.
But we
But I
wouldn't
feel
be
like you can still trip on
You
the
can.
even like the if the rug is still sticking down, like you said, if you don't lift your foot high
Right,
enough
exactly.
and you're stepping onto the rug
Exactly.
and you think you've lifted your foot high enough, you could just trip on the lip of
Exactly.
the rug, right?
Hence
Yes.
why we say remove them.
I
But
totally understood.
We've had many discussions, hard discussions with some of the seniors.
Or
with
sometimes
regards
they
to this.
remove them while you're there. When
And
you
then
come
put them
back.
back.
They're back there.
Unbelievable.
Oh,
Another thing-
Listen, sometimes we're attached
I
Yes.
to
know.
our things.
I know.
And that can be difficult to come
Yes.
to terms with having to do something that actually helps in
Right.
preventing
Yes.
certain issues for you. So I get it, and
Yeah, and we try not to make too much
Big changes.
but
Yeah.
changes that are necessary.
yes,
Yeah.
totally understood.
Yeah. Another thing is clutter in walkways and stairs. So again, trying to get rid of them or get rid of those items if possible. Electrical cords, which Shirle mentioned earlier
And
in
so
our
did you.
walkways, and also you. And again, either have the cords rerouted or just try and remove them if possible, or move the appliances closer to the outlets so that it's not running. Slippery floor surfaces, so be mindful, especially here in Bermuda. We suffer with, or we have high humidity, and if we have tile in our kitchens, our bathrooms, when it's high humidity, it becomes really, really slippery. So you have to be very careful. In addition, during these times when you're cleaning, what cleaning products you put on the floor can add to
the slippery.
yes. So you have to be mindful of that, of the residue. Another thing is not enough room to maneuver your walking aid. So I think you had you answered correctly when we asked you earlier. But if you have a walking aid or a cane, you want to make sure that if you're entering a room, you have enough room to maneuver. What else is here? It's a lot.
There's so many things that put you at risk for falling, right?
Yep.
I think you don't really think about it unless you're in a space where you've fallen before.
Right.
Exactly.
And now everything is significant to how you move around in a space.
Another thing, which is what I'm probably dealing with right now, is inappropriate furniture height. So difficulty getting up from or onto a bed or a chair, especially if they're really low. So what you could do is actually get furniture raisers, which you can purchase at Masters or Gorham's. You can put them under your bed, under your chair, to make it higher for you to, and easier for you to get up. I'll do a couple more from the kitchen. Frequently used items that may be difficult to reach. What you can do is get someone to put those items on a countertop so that they're easier for you, so you're not overreaching or bending down. Poor lighting, again, is another big thing. And that could also be for the bed, all the rooms basically. 60 watt, using at least 60 watt bulb batteries. In the bedroom, again, if you have an active bladder, for example, and you're having to get up and go to the bathroom quite a lot during the night, it's good maybe to get a urinal for men or a commode chair by the bedside, so you don't have to get up as often and walk great distances, especially when you're sleepy. So again, one thing we do mention is about having a night light on, or a light on at night, so that if you do frequently go to the bathroom, you have something that
a lamp or something like that.
Exactly. In the bathroom, again, lighting is important. We talked about frequently used items, just having it on a countertop so it's easily to reach. Water temperature, if it's too hot, you want to make sure that it's an appropriate temperature so that you're not jerking or having a reaction and then you end up slipping because the water is too hot or too cool, for example. Installation of grab bars, that's important. We do recommend that in the shower, in your bathtub, next to the toilet. They will actually be quite beneficial with that.
And just a minute, and looking at the grab bars, what about the suction ones?
Yes, so I'm glad Shirle brought that up because they're cute and people don't like to mess up their tile in the bathroom.
So there are different types of grab bars and how they're installed.
Right, so we're talking about the ones that you install. A carpenter will come in and they'll actually drill holes in the tile. And I know people are having a panic attack right now, me saying it. So some people will actually get the suction cup ones. And of course, with high humidity, as I mentioned, right, the tile is slippery. And we've had quite a few of our clients where they've ended up on the floor because
it creates a further risk.
They're not reliable.
And they come off the wall. What else, Shirle? Let's see. Oh, use of non-slip mats in the bathtub as well as out. unable to safely use toilet, tub, or shower. So we'll talk about this towards the end of the podcast about.
So you want to use, but just to go back to the non-slip mats, you want to use the non-slip
Yes.
mats
Yes.
in the bathtub.
Yes.
And
Yes.
I said,
Yes.
okay, just
Yes,
want to clarify that
definitely.
one.
Yes.
And also, about the rails. The occupational therapist will come in and tell you the perfect
Height.
placement and height for the rails. You can't just go and put them in just as you want to. There are ways to put them in.
Okay.
So another area of the home is your stairwell. So again, lighting is important. Making sure that you install handrails or grab rails if possible. Making sure you're mindful of the lips, because some people have little lips that go into the front door, or so be mindful of that. An ill-fitted carpet, if it's gonna cause a problem, just remove it or get it secured. Other things which may also contribute to falls is pets. Your dogs, your cats.
Yes,
You
I
know?
have a little tiny dog
Yes.
that
Oh,
like
yeah.
comes right next to my
Exactly.
foot,
Right.
and I'm like trying to stumble over him so I don't step on him.
Right.
Exactly.
And,
So
and
you-
if you've got poor vision, and you don't, and a little pet,
Yes.
you don't know it's right by your foot, which probably where they like to be, right next
Yes.
to you.
Yes.
Yep.
Yes.
Yes.
So you answered that right there. Just be mindful. Improper or poorly fitted footwear. So we always encourage our clients to, when they're walking around the house or outside even, closed in shoes. You have these pictures in your mind, especially for women, these cute little like clogs or what have you, and you're being cute, but they can pose a major risk. So also we want to make sure that the bottoms of the shoes are non-slip, so rubber non-slip
Okay.
bottoms.
And not
Okay.
only should they be non-slip, but make sure that they're not, like they're connected. They're not got a edge on it.
Okay.
You know how
Meaning
sometimes a
like it's
little bit
not
of the
rounded.
rubber
It
may-
needs to
the-
be flat type
Right,
thing.
but the little bit of the rubber may come unattached to the sole,
Okay.
so that can cause a trip problem.
Okay.
And also, if you have issues with balance or what have you, and you're dressing and undressing and standing up, just making sure that you do those activities sitting down, so that it mitigates your risk. Another big thing is your phone's ringing, the doorbell's going off, and what do you try and do? You rush to the door, you rush to the phone. Let them wait. Especially if you have issues with mobility, take your time and get to the phone. And if it's important, they'll call back, or voicemail will pick up the message.
Oh wow, there is such a long, and this is just inside of the
This is just
home
inside
that we're
the
talking
Yeah.
about.
Yeah.
So you mentioned earlier outside versus inside. These
So-
are all risks related to inside.
Inside.
So what are some of the risks related to outside?
Again, it goes across poor lighting, lighting inside and outside. Uneven walkways or terrain, like if you've got stepping stones, if they're not even, that's a risk. And slippery walkways. And I know a lot of times we have to be careful of moss
Yes.
growing. That makes
yes,
it very slippery.
Yes, we used to
Okay.
put bleach down by our
Right.
laundry room and use a broom to kind of try to
To-
scrub it
right,
up.
yes.
Because it got very slippery right there.
Yep.
Okay. And if you're walking on an uneven surface, you either have a second person with you or you use your assistive walking device like your walker or your cane and something that's been properly measured for you.
Yes.
Because there's a proper measurement that you have to have your walker or your cane or even your crutches at to make them safe.
But some of our Asian population are walking without those things. So if that's
Yes.
the case, what would you do? Because you
Yeah, if
you
they're
could be
fine-
aging, but you're walking without a
Right,
device.
and that's fine, and that's why exercise is important. So exercise for balance, the core strength. That's you need that. So if you're walking without an assistive device, that's fine. You just always, everyone has to be mindful of the surface they're walking on, and just
take precautions.
just taking their time. Yeah,
Yes. Okay.
yeah.
And if the physiotherapist has prescribed you, a walking device, please use it. Many
Right.
times we'll go to people's homes, and the devices are parked at the door. What use are they going to be?
And also, your devices have to be, like if you've had a cane, you have to be careful of the tip. It gets worn if you're quite active and using
So
it a
making
lot.
sure you-
Right, because if the tip is worn and you go on the floor, that cane or crutch can slide right from under you. So making, again,
Interesting.
another risk.
Okay.
And I just wanted to get back to the bathroom too.
Okay.
The toilet paper, because sometimes now they have the fancy toilet papers that you don't have to go in the wall that's right beside the toilet, but make sure it's within reach.
Yes.
Okay, and did we mention about they have for the toilets, they have surround arms if you have a hard time getting up from the toilet, so you can have something to push on. And
Okay.
nowadays, I think standard toilet heights are higher than they used to be, because they are 17 inches now. They used to be much lower, like 13
I
inches.
know, but if the toilet's too low, then you can't get up.
Right, exactly.
So that's why, an occupational therapist or physio can prescribe a commode chair. You've probably seen those, or surround arms. And all those things can be height adjustable. So
Okay.
And also looking at steps. Sometimes the steps are not uniform height. So you just need to be wary of that. Sometimes the steps have a lip on them. So you have to be leery of that as well, so you don't hook your toe on the lip as you go up.
right.
And the railings, when the railings are installed, they have to be, 12 inches further
Yeah,
than the
than
top
the-
step, and 12 inches further than the bottom step. So when you're stepping off, you still have something to hold on to.
Yes.
Okay. And I think you mentioned this already, Nicole, but having maybe you didn't, a chair or a table, like if you're going home and you've got to get your keys out, and you've got packages in your hand, have a little table or a
Something
chair
outside.
there so you can rest your things on.
Yeah.
And one more thing, if you have a Medi alert, please keep it on you.
Yes. I'm only laughing.
Yeah, no, because those
yeah.
commercials of I've fallen and I can't get up. No, it's honestly because I've heard stories, and I find that like having something like that, you would save
Yes.
yourself from even making whatever injury you have worse from being down, for
Right.
so long until someone can find you and
you.
help
Yeah.
you
And
and
I-
all of those things.
Yeah,
Wow.
we've had a lot of heard a lot of stories about that. Where I think I had a client at KMH, I think, and they were on the floor for I think a whole day.
Oh my
You know,
gosh.
yeah, so they were in a bad state. But the reason why I was laughing earlier is not because you need a Medi alert. That's not it. It's because we've gone into people's homes and we know that they've got a Medi alert, and we're like, okay, well, where is it? Because sometimes they come in a watch form or a necklace, right?
Oh, I like the watch idea.
Yes. So one lady, we went into her home and we were having a time to convince her to wear it, because we said it's not beneficial if it's over there. And every time we went, it was in a plastic container
Packed
with the
away.
top on, packed away.
Oh no!
Exactly,
So if
and
you
she-
fall, you can't reach it.
Exactly, and she was at major risk. She had many falls, but and it's actually some of them, I think one company, they actually sell one where if you go outdoors, it has GPS. So if
Yes.
you're going into the trails to walk or what
Oh,
have
wow.
you,
Yes.
yeah, and you trip over, say, a raised
a rock
root or whatever,
something, Bermuda
they
trails.
will, yeah, it will be able to locate you. So they're actually very beneficial. So please wear them if you have them. Please, Bermuda.
And one thing we didn't mention, in the kitchen and in the bathroom, have the items that you frequently use at a level that it's easy for you to reach. Not down too low and not up too high. So
Yes.
within arm's reach, have those things.
Nicole mentioned
we
earlier,
mentioned
like
that.
We did?
she
Okay,
was
I'm
saying
sorry.
either no, that's okay, because you know what, reiteration helps as
Yes,
well. And she was
exactly.
saying kind of bringing things down to a level, or putting a table or something somewhere where you can actually do that. I
Exactly.
think that we have like touched on so many things that you can be at risk, and even so many solutions to preventing falls as a result of that. And so my question, because you mentioned a couple times what you do in terms of when you go into clients, so what role does the community rehabilitation services play in regarding falls prevention in the community?
Sure. So, all the referrals that if you are in need of a OT or PT in terms of this subject matter, we'll need your GP to make a referral. So once we receive it, we will process it, and then we'll go out into your home. So, the telephone number, if we can put it in there, is 278-6428, or you can fax the referrals on 295-7636. Once we get the referrals, like I said, we'll go into the home and we'll do a functional assessment. So basically just seeing how you manage around the home, so looking at your mobility, how you get on and off of furniture, washing, dressing yourself, or how you manage in the kitchen, the bathroom, etc. But there are three things that we do with every client. One is a full screen, and this is a standardized screen that we use specifically for the community and for persons 65 years and up. We also do a home safety screen as well, so we'll look at everything from lighting to furniture heights, to what type of equipment you have, the flooring, is it carpet, is it tile, etc., etc. And once we do all these screens, based off of the outcome, we'll provide recommendations. So those recommendations we already touched on earlier about
in terms of what are the risks and what
Exactly.
can you do. So if you had a rug in the house, then you would recommend removing, and if they don't want to remove, you would customize your recommendation
Exactly.
Right.
for that situation.
Yes.
Exactly.
Okay.
So we do that within our service. So yeah, it's a good thing.
Yeah.
And so that was the occupational therapy component of it, and PT. You work with that.
Yeah, we work together
Yes.
Okay.
with most of the clients, yes.
Okay.
And Shirle mentioned very early in the podcast another thing which I forgot to mention is we will prescribe a home exercise program.
Yes.
Okay,
if
so
we-
that's where.
Yeah, so yes, that's kind of where Shirle, but we overlap in a lot
Yes.
of things.
You know,
and
one
also,
thing, I'm sorry, go ahead.
yeah, no problem, prescribing walking aids or adaptive equipment. So, sorry.
Okay.
No, it's one thing I forgot to mention is about steps. If you've got vision problems and you can't see the borders of the steps, sometimes a different color paint on the edge of the steps so it's easier to define which, what is the next step.
That's interesting.
Yeah.
Okay.
And sometimes you might say you're walking and, this has X amount of steps. It takes X amount of steps to get from point A to point B. So just being
Remembering
mindful.
and being mindful of
Yes.
how many
Yes.
steps, especially if you, completely vision impaired or
Yes.
something like that.
Yep.
But you can only access your services through referrals.
Yes.
Yes.
So it has to be through a person's GP or
Oh.
can the clinic. Do they get clients that they can
Yeah,
refer to
yeah,
you, or how
yeah,
does
they
that
do,
work?
they
Because
do.
I know you're talking about the aging population.
Yeah, so again, like you mentioned, GPs, but we also have had referrals from social workers, from nurses, from other allied health professionals. So, say, occupational therapists or physios from the hospital. Because if someone's an inpatient and they're about to go back home, they may need some
Assessment.
Yes.
Assessment. Yeah. So.
And sometimes if we get a referral, say referral only comes for PT or only comes for OT, and we want to combine, so we'll just cross-refer.
Yeah.
Right, because you
Yeah.
talked about it being a kind of really false prevention being a multifaceted,
Yes.
Exactly.
like have multifaceted approaches, right? And it seems like that your jobs are highly collaborative in the sense that
Yes.
you really do have to bring in all of the experts relevant to what are the needs of that client, needs of that home, or whatever that may be, because right, there are some adjustments that have to occur. So I think that it's really cool in the sense that we understand that collaboration is really important for
Important.
certain things in our community.
Yeah.
And looking at this and looking at falls prevention, and you wouldn't think that, you have to have this, you have to have that.
Yeah.
Something as simple as a hardware store.
Right.
Having partners or having knowledge of different community vendors that you can access that have that equipment
Right.
for your clients. And so I just think that's really important. So are there any other resources that are available in Bermuda in reference to falls prevention
Of course.
and things of that sort?
Yeah. So both Shirle and I, we work there, but BHB has quite a number of services there. So inpatient occupational therapy, physiotherapy services. They have outpatient PT services, the Rehab Day Hospital, the Limb Embrace Clinic, which focus on specialized shoes or braces as well. And these are all GP-generated referrals. You also have a number of private physiotherapy clinics. Some require GP referrals, or you can just walk in. Shirle mentioned this service earlier, Vision Bermuda. This is an excellent service that focuses on people who have low vision or vision issues. And they actually have a vision rehab specialist, I believe, that will go out into the homes and sort of do some of the things we do as well. Speaking on exercise, muscle weakness, etc., there are a number of exercise groups around the island. You have Lifelong Learning Center, which is out of the Bermuda College, and you also have Pembroke Community Center. In terms of purchasing small and large adaptive equipment, I think you touched on hardware stores, etc., but we have Red Cross, where you can rent some of these pieces of equipment. You have Lighthouse Medical, Medical House, Masters Gorhams, and some of the pharmacies are really good. They would actually have some adaptive equipment as well.
Oh, really?
Yes, you wouldn't think so.
No, I would. I mean,
yes, they do. Some of the larger pharmacies, they do.
Oh my gosh, it's been an amazing discussion, to be honest with you. So much information. I honestly feel like you have even more information to share with us. But with limited time, we're not going to continue to go on, but I really feel that this is an important topic matter, subject matter, in the sense of what it can really do for people in the community in terms of aging at home, or just falls prevention in general, and the relief and burden on our health systems that it could actually contribute to. So I want to thank you, Nicole, and I want to thank you, Shirle, for coming on and having this very important discussion with us. I want to thank our listeners, our Bermuda Health-Abetters, for coming on and listening. Again, you were listening to Bermuda Health-Abets, a podcast where we discuss everything from A to Z on healthy living. And tune in to more of our discussions. Watch out for our Facebook page and our YouTube channel at Department of Health Bermuda for more episodes of Bermuda Health-Abets. Thank you so much for our guests, and thank you so much to our listeners.
Thank you for having us. And just remember, falls can be prevented, and you have the power to reduce your risk.
Thank you so much.
Take care.
You have been listening to Bermuda Health-Abets. Please note, anything you heard on this podcast is not a substitute for visiting your healthcare provider. If you have a topic or want a question answered, please contact the Health Promotion and Wellness Office of the Department of Health by emailing healthpromotion@gov.bm or by calling 278-4900. Be sure to listen out for the next episode of Bermuda Health-Abets.